part 3 is all about vascular occlusion and blindness. Blindness is 1 in a million.
The quantity that they can use might be 20 times more than what we would ever dream of using.
Cowboys of the industry.
So if you're in the right hands, that should never happen.
You should ask your practitioner before getting dermal fillers done. Okay, practitioner, and if the answer isn't, then run a mile. Hi everyone, I'm Dr. Zoya, this is Dr. Sanjay and Dr. James, all from Trikwan Aesthetics. And today we are doing part 3 of our 4-part series on what are you most afraid of when it comes to dermal fillers. So part 3 is all about vascular occlusion and blindness. Sound like very scary terms, but we're going to break it all down for you today in this video, and we're going to go through all of your concerns.
So Dr. James has a background in surgery and he's going to help us answer the question, what is a vascular occlusion?
Awesome. So vascular occlusion effectively means a reduction or a stop to blood supply to a particular area. So when we inject things like dermal fillers, there's 2 things that can cause that. If we inject the filler into the artery, or if we inject the filler into the area surrounding the artery, then that can cause external compression to the blood supply. Now, obviously, every part of the body has a artery and a vein supplying it and taking blood away. So if you disrupt the blood supply to a certain area, then that area doesn't get the oxygen, it doesn't get the nutrients, and effectively that can lead to death or ischemia or other kind of problems in that area.
What's ischemia, James?
Ischemia means effectively the same as what I said in terms of oxygen supply to that tissue area. So it's not getting enough oxygen and other things to keep it alive.
So how common are vascular events? It's a really important question and actually is quite difficult to answer. When we look at recent research that's been published, the incidence of vascular events is looking like 0.01%, which sounds incredibly rare. And we're going to link these studies for you to have a look at yourself. But having said that, within the UK and other countries across the world, it's actually very difficult to get a hand on real reliable data because who's actually performing the injections? I mean, this is quite an unregulated field. There are a lot of treatments that go on kind of under the radar, and not all procedures are done by licensed healthcare practitioners or medics. So within the UK, there is no single regulatory body who actually gets all of the data from all the complications or all of the adverse events. If we're going to talk about things like the NHS or healthcare systems, usually there's going to be one body who receives all this information and then they can use that to get conclusions or to help educate or improve the standards. However, within aesthetics, it's a little bit different because you've got so many people who are non-medical who are injecting, and these are not going to be followed up properly or appropriately. So with vascular events, the data isn't really there. Having said that, there's a paper that came out recently, or there's a body of data that Dr. Zoya is going to be talking us through now. Yeah,
so in America, things are done a little bit differently. So in America, there's the FDA, where a lot of these sort of complications or adverse events that arise, especially vascular occlusions from aesthetic treatments and dermal filler treatments, are recorded. The large body of evidence that has come has been from dermatologists. So there was about 400 dermatologists that took part, and it was over a 5 to 10 year period where they injected millions of dermal filler syringes. So out of these, there was a risk of 1 in 5,000 people having a vascular event or a vascular occlusion. This reduced significantly by up to 70% with the use of a cannula. So now we're going to talk a little bit more about cannula and needle. So these are 2 main devices that aesthetic doctors use to inject dermal fillers. A cannula is a blunt-ended tube, so nothing sharp is going anywhere near your tissues. It's actually a blunt-ended tube that can travel into different planes of your tissue and inject filler where you need it. A needle is a little bit more precise, and you put it into different layers where you want to inject the filler. So what this paper is finding is that actually the cannula is a lot more safe when it comes to vascular occlusions. So Dr. James is going to talk a little bit about sort of why this isn't something that you can always rely on.
Yeah, exactly. So I think a lot of patients and people get sort of slightly focused on the difference between needle and cannula, and it's important to remember that there are 2 main variables which will dictate a patient's outcome. There's the injector themselves, their qualifications, how skilled, their sort of understanding of the anatomy, and then it's also the product used as well. And so if you appreciate that and treat each patient with the sort of bespoke and understanding that you're going into an area which is their own unique anatomy, then you will realise that sometimes the needle and cannula sort of variety and divergence is actually a bit too broad, and it shouldn't really be held to such strong sort of viewpoints, and actually comes a lot down to who is wielding that needle and cannula and their anatomy knowledge and their sort of experience. Really, that's the main thing to focus on.
Yeah, and also in regards to this paper, it wasn't just hyaluronic acid dermal fillers that we use. So hyaluronic acid is what we use in our clinic, and it's because it's the safest, and it is, you know, very similar to our natural hyaluronic acid that we have in our own bodies, and it can be dissolved using a dissolving agent called Hyalase. So that's what makes it a bit more safe.
It's reversible.
Yeah, it's reversible. So when these events do occur, then we've got something that we can use to correct that. So that's something that should be very reassuring.
And also the Hyalase as well, that's something which your body naturally produces. So effectively your product and filler breaks down because of the small amounts of that in your body anyway. So all we do is, when we dissolve it, is give a higher concentration. So, you know, there's not a sort of an apparent product that your body's not used to. It's actually something which your body also makes.
The fillers aren't always hyaluronic acid. A lot of the time, it's going to be soft fat. It's going to be polylactic acid. It's going to be calcium hydroxyapatite. All of these are non-reversible fillers. So those are going to cause more problems, and that's what we see in all of the research and in all of the papers, that actually when you use non-hyaluronic acid type fillers, you're undoubtedly going to get more problems.
And even looking at some of the papers, when they talk specifically about quantities of filler being used in certain areas, the quantity that they can use might be 20 times more than what we would ever dream of using in that area, because anatomically speaking, we know that it's a more high-risk area. So there's sensible injecting with an understanding of the anatomy, and these things greatly minimise the risk of anything going wrong.
Exactly, which is why it all comes back to knowing your injector, and it's not, you shouldn't be afraid to also ask questions to the person that you're having the consultation with in terms of what product they're going to use, the qualifications, their sort of experience and things. You know, it should be a two-way conversation to enable you to feel comfortable and educated about what's going to happen. Yeah,
and I guess, you know, what we're going to discuss further along in this video is how to mitigate these sort of issues as well, and how you can avoid this kind of event occurring. So 1 in 5,000 can sound like a lot to some people and can sound like very little to some people. So that's your own personal sort of choice in terms of using that information and making your own informed decision on whether you get fillers or not. But the key thing to note is that this 1 in 5,000 risk of vascular occlusion isn't a vascular occlusion that leads to tissue death and necrosis and all the things that James was talking about earlier. A lot of the time, and I would say pretty much 99% of the time, if you're in good hands, you will note that vascular occlusion happening immediately and you will deal with it. But it's important to have someone experienced, someone that knows what they're doing, and someone that knows how to handle those complications and deal with them quickly.
If there is going to be a vascular event that's going on, as you mentioned, one of the most important things is quick diagnosis. Because in these scenarios where for there to be a truly devastating consequence like tissue death or blindness or this type of thing, typically it would need filler that's gone wrong, so into an artery, and a vascular that's being missed and continually being missed and nothing being done about it, and they're getting worse and worse and worse and worse and just being ignored and ignored and ignored. So if you're in the right hands, that should never happen, because if you do thousands or tens of thousands of things that you recognise as normal, as soon as a vascular is going on, it's clearly not normal, and it's very, very obvious to the practitioner, something suspicious is going on here, I need to investigate this or look into this a bit more. So blindness really is the scariest consequence of a vascular event, and I think we should dig a little bit deeper into that. So how common is blindness, and is it really something we should be worried about?
Yeah, so blindness is something that occurs in 1 in a million, and that's the data that we have globally. So that can sound like a very low risk to some people, but some people, 1 in a million is a risk that they do not want to take. And actually it's very important that you have that knowledge, and that then you can make your own decision based off of the actual stats and the facts.
And you know, that 1 in a million number, for example, with the blindness, that number will include some really experienced practitioners, and it will also include sort of your cowboys of the industry, the sort of inexperienced, the ones who aren't going to pick up the vascular occlusion in the early stages, and therefore it will lead to blindness.
Yeah, so I guess the key thing to note is that yes, the vascular occlusions can happen, yes, blindness can happen, and those statistics we've already given you, but there are a lot of steps and a lot of symptoms and a lot of signs that you can see and you can sort out way before you get to any of those stages. So So yeah, vascular occlusion and blindness should be an absolute end destination kind of situation where we never want to even get there.
So just to summarise some of the things that we do here at Trikwan to help minimise the risk of a vascular, of course with every patient it starts off with the consultation and understanding the patient's unique anatomy, because some areas are going to be more high risk than others. Next, we're going to talk about the product choice that we use, and we want to make sure we're using the highest quality form of dermal filler we could possibly use within the treatment area. Finally, when we're treating the area, we want to make sure we're using the best techniques, and techniques are something that are always sophisticating. There's always new research coming out, there's always new data coming out with regards to this, and I think it's really important for not just us but all practitioners to stay up to date with the latest research. And if they can, get involved in research. So the doctors at our clinic are quite heavily involved in research, and we often publish papers in and around the subject of complication management and techniques and how to do things better with dermal fillers. Other things that are really important are even straight after the treatment, we need to check and assess and make sure that we don't think there's any suspected vascular going on or anything strange going on immediately after the treatment, and then follow up with the patient. So how are they doing a day later, how are they doing over the next few days or weeks or so, because I want to hear and I want to know that everything's going nice and smoothly for the patient.
And also, I think there's a really good question that you can ask your practitioner if you're ever at all seeing someone new or you're weary of anything. You should ask your practitioner before getting dermal fillers done. Okay, practitioner, if at 2 in the morning I feel like I've got a lot of pain or something just doesn't feel right, what do I do? And if the answer isn't, we have an emergency contact phone for you to contact number any time of day and we will respond, then run a mile.
Safety netting is key in this thing, isn't it?
Yeah, it's good advice, yeah. So to summarise, what separates a really good clinic from a not so good clinic is going to be, if something does go wrong, how do they handle it? Because in the case of anyone having a vascular, is it recognised quickly? Is it seen to quickly? Is the team kind of coming to see you straight away, or are they opening their doors for you straight away, or are they saying, you know, come back next week? Because these types of things, alarm bells will be ringing. I mean, if we were to have a vascular in our clinic, it would definitely be the case where, you know, anyone here would drop what they're doing straight away and come here to see a patient immediately, because it's really important.
So thanks for watching. We hope you enjoyed that video. Thanks, James. Stay tuned for our next video, part 4, which will be coming out soon. And if you're enjoying all this educational content that we're trying to put out there, then please, if you can, like and subscribe to our channel. It has to be natural. Is it?
Guys, you know you want to do it. Just give us a follow and...
Yeah, great.
I think we're closing in on 500 people after 5 years, so.